I would like to take you through a typical facelift patient in my practice. And what I'm going to try to do is I'm going to try to take you through the whole process. So we're going to talk a little bit about the consultation, what we discuss in the consultation. I'm going to talk a little bit about the technical part of the surgery, what I actually do, and then we're going to talk a little bit about the results. So this is a very pleasant 72-year-old patient who presented to my office a couple of years ago, and she's still working. And the industry that she works in is an industry dominated by young people, and she was concerned that her appearance was limiting her ability to stay productive and to stay relevant in her job. So when she came in to see me, her primary concerns were just the gauntness of the face. So if we look at her pre-op pictures, she has lost volume in the cheeks, she has an irregular jawline, and she has loose neck skin. So when she presented to me, she was a very vibrant, fit 72-year-old, still working, wanting to look young for her job and also just to feel more youthful. So after a discussion about this, the things that she wanted done, the things that I think should be corrected, we decided to do a facelift, and the facelift would tighten the cheek, the jawline, and the neck. So, in review, her primary concerns were the loss of volume in the cheek, the indistinct jawline, and the loose neck skin and the lines in the mouth. So now if we look at her post-op pictures, she looks 10 to 15 years younger. So I have restored the volume in her cheek. I have created a nice smooth jawline. We've gotten rid of the loose neck skin, even though we didn't make an incision underneath the chin, because sometimes you don't need that. And we've made the eye significantly better. So with one operation, in this case done under local, I was able to restore the natural appearance of the cheek, the jawline, the neck, to soften the lines of the upper lip, and to add volume to the cheek, more similar to she had the volume that she had when she was younger. So to me, she looks much better. She looks rested. She looks fit. She looks youthful. And this is more like what she looked like 10, 15 years ago. So in her case, I tightened the cheek, the jawline, and the neck with my facelift. And then I added volume to the areas that had lost volume with fat. And then we gently removed some of the lines using dermabrasion, which is a great technique. So she came back and she was very happy with the results. And I said, well, do you want to do anything for your lower lid? And she said, no, I think it's great. And so we corrected everything that she wanted. And this is just an example of, I always listen to the patients about what they want. So now this woman, she looks great. So people want to look natural after facelift surgery. And so people come in all the time and they say, I don't want to look done. And people don't want to look done, but they want to look better.